today we were talking about the suboccipital region,
Yes,
I
that's where
believe.
we're starting
So,
today.
yeah.
Yep.
hmm
Yep. So as a quick introduction, why don't you introduce yourself for all the
hmm
fine people there?
Yeah, so I am Ben Ciccarone with Wellness Way Massage, and we are right across the hall from Rothrock Chiropractic and Rehabilitation.
hmm
And you can find us online at wellnesswaymassage.com. And yeah, over to you.
Yeah, Dr.
hmm
Emery Pitcel, Doctor of Chiropractic, owner of Rothrock Chiropractic and Rehabilitation. Also across the hallway from Wellness Way Massage, we are across the street from the old auto port and directly across from the
hmm
Ramada Hotel. Maybe if you
hmm
look finely enough through that window, you could see it on
hmm
the video here. But yeah,
hmm
this is our B school, our Be Better, Be Empowered. Ben and
hmm
Emery. Hopefully, you
Yes.
guys see what we did with the BE there, right?
Yes.
And this is actually already our third episode.
hmm
Crazy enough, I can't believe we're already on episode number 3. Like Ben
hmm
said, we're going to dig into the suboccipitals today.
hmm
That sounds like a big fancy word, but
hmm
not really. When
hmm
you think about it, if you break down the
hmm
origin of the word, right? So
hmm
sub is below, and the occipital or the occipital bone, right,
hmm
is right here on the back of the skull. So literally below the skull is what
hmm
it's telling you. So the muscles are
hmm
right here.
hmm
And how common do you find this presentation to be on your side of the avenue there, Ben?
Um, common, I would say 90% or I don't
Yeah.
know. It's a good amount of well, yeah, lately I've been seeing like most of what I've been seeing there's a lot of suboccipital stuff that
Yeah.
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 Well, of course, I like to always pull my chiropractic
Mhm.
analytics, and I would agree with Ben. There is always going to be some sort of dysfunction or muscle tension
Mhm.
in the suboccipitals. But according to some of the research I pulled,
Mhm.
we find that 30% of people that come to a chiropractor will actually list the neck as one of their top 3 concerns to be addressed. So that'll
Mhm.
come in as a chief complaint. And then
Mhm.
about 11% say headache.
Mhm.
Now, like you, I think the number is higher than that, but just from a very strict, I came to a chiropractor for
Mhm.
XYZ 30% neck.
Mhm.
And then if we're talking about headaches, which we'll dive into in a little
Mhm.
bit here, then we're looking at about 11%.
Mhm.
But yeah, I would be willing to say anybody that comes here and
Mhm.
they say, like, hey, could you do a little bit of
Mhm.
neck work with me? Probably 100% chance I'm going to touch up your
Mhm.
suboccipital muscles because
Mhm.
it's a pretty common place for muscle tension to hide.
Mhm.
And that kind of brings us to our causes of pain. Like, what do you predict or perceive is the reason why we actually see 90% of people needing suboccipital muscle work?
I think you're alluding to it a little bit earlier that
hmm
we are not using our full range of motion on a day-to-day
hmm
basis
Right.
for those muscles. So that's when you're not using a muscle, then it only takes about 3 days for a muscle to get tight after it's been stretched. So it doesn't come as much of a surprise
Really,
to me.
as little as 3 days.
Yes.
Oh my goodness. Well, that's kind of sad news.
Yeah, that's like if we looked at the muscle tissue under a microscope.
Yeah.
That's what you would find.
Yeah.
But yeah, so that definitely makes sense.
hmm
That um, it's when like it's within like the neck, back, and shoulder, kind of the
Yeah.
trifecta,
Right.
right there. So.
Yeah, and I like
hmm
that you said that too. We were having this discussion and we had this realization before we went live on recording the podcast here that I think I preach a lot in office about postural over favoring or movements that we over favor.
hmm
And yes, a lot of our positions are with poor posture with that head craned forward.
hmm
And you think like our tech neck, so our cell phones or our tablets or our books that are down below, and
hmm
all of this stuff is going to be the cause of loading up those suboccipitals and making them tighter.
hmm
And so we have all this time forward
hmm
and down, but we don't necessarily go back enough in extension. But
hmm
then you and I had the realization, and it was kind of like a
hmm
flashing light bulb went off for me. It's like,
hmm
wait a second, not only
hmm
are people not really moving enough into that,
hmm
but how often are most of us really taking the time to get enough of our full neck rotation
Mhm.
throughout the day, the side to side, like checking your blind spot in the car? And the
Mhm.
honest answer is probably not enough.
Mhm.
And then when you say it takes 3 days for that muscle to recontract and to kind of
Mhm.
go back to the adaptive shortened position after
Mhm.
massage, stretch, or exercises, well, gee,
Mhm.
not a surprise we see as many
Yeah.
suboccipital problems as we
Mhm.
do. So yeah, I would see lack. We would say lack of movement. I think we'd also, of course, say posture. Again,
Mhm.
if we're spending too much time on our computers and sitting,
Mhm.
and especially the more our posture slides to here, and the more we're looking down at things, it's gonna
Mhm.
create problems in the suboccipitals. Correct?
Mhm. Yeah, that
Yeah.
is that's for sure.
Yeah.
um and the other one that I mean commonly
Mm-hmm.
that I see a lot of is a lot of people carry tension in their shoulders,
100%.
and then when and then that translates to issues with the neck and leads into headaches and stuff. So
Yeah.
if you know if we can get that, you know, um if we can treat that, then
Yeah.
that helps a lot. So
Yeah.
yeah, so
Yeah.
that so yeah, so having, because for a lot of people it's natural just to, you know, have that buildup of tension in the shoulder area, and it just keeps
Mm-hmm.
accumulating, and
Yes.
it doesn't tend to go away. It's kind of, it's almost like the body is is storing that information into the muscle memory
Mm-hmm.
almost. And so it's yeah, so stress is definitely a big cause of issues in the shoulder neck
Yeah.
area.
So,
So
as a quick recap, we said poor posture, not moving enough.
hmm
You alluded to stress and even stress in other areas.
hmm
And then we were talking about another one beforehand, so I'd be remiss if we didn't
hmm
share it with the public here, overactivity. So,
hmm
let's think about maybe a sport that really does maybe require that you do kind of move that head and neck a lot, or
hmm
um, hey, I'm a self-professed metal head and I love rock and roll and metal, but you go to
hmm
a concert and you headbang it out a little bit and you might
hmm
you might overwork those
hmm
muscles and have issues. Or I
hmm
know I had a gentleman that I saw that I treated back in Illinois that
hmm
was a crane operator, and all his work was over to the right and looking down. So
hmm
he always had issues because this muscle was shortened on the right side. He would always come
hmm
in and always just be right side neck pain, and that
hmm
suboccipital was like tight as a rubber band on the right, loose
hmm
as a goose on the left.
hmm
So you get the idea. It's much like anything, posture,
hmm
but not enough movement is a problem, but too much movement and too much
hmm
activity is a problem as well too. So
hmm
hey, we've been talking about the causes of pain
hmm
and we've been pointing a lot, but let's just set
hmm
the record straight. Where do we see a lot of the pains? Where do the symptoms kind of pop up on people there, Ben?
hmm yeah.
As far as suboccipitals, when people have suboccipital problems, like the obviously
hmm
here, but where else does
hmm
that pain do we find usually like to travel, or what do you kind of see?
well, it really depends. It might not always be where you think
Well, of course,
it might
yeah.
might be going. So it involves a lot of communication.
Hmm.
So you're doing the work with those muscle groups, and then you're checking in with the patient to see if there's any referral of that pain. So if there to see if there's like a muscle knot or something um, that can be worked out so that
Hmm.
you don't have all of that triggering a headache, for example, or it can also travel down the arm
Yes.
or something like that. And it doesn't have to be pain.
Hmm.
It can be any type of sensation
Hmm.
where it might even feel like something might be so restricted that it almost might feel like oh, now the blood supply is fully able to get through
Hmm. Hmm.
through that area. So
Yeah. Well, and I like that you mentioned
hmm
it doesn't have to be pain because sometimes people
Mhm.
will mention like, hey, like tingles, or it
Mhm.
feels like there's pressure here, and they might not necessarily say
Mhm.
like that hurts, but they're just like it feels off.
Mhm. Yeah.
And so I think that's a huge thing to kind of
Mhm.
highlight. And
Mhm.
you said the big word that I was kind of looking for, and I was trying to tee you up for
Mhm.
referral. The
Mhm.
suboccipitals are most classic presentation that we see when they get really, really tense
Mhm.
and exasperated, and they
Mhm.
start to refer. Yes, they can refer down, but I think we see a lot more of they refer into the tension type headache.
Mhm.
So, and that's the headache that you're going to get then, where somebody says it feels like most of the pain is on the back of the head,
Mhm.
and then as it gets worse, it kind of wraps up to the eye. It almost looks like
Mhm.
if you've ever seen the Los Angeles Ram football helmet,
Mhm.
it kind of looks like you're trying to draw the Ram symbol.
Mhm.
And
Yeah.
if you got a headache that's presenting like that, then
Mhm.
oh, that's 100% in
Yeah.
the wheelhouse of chiropractic and
Mhm.
massage therapy, because you're going to have some sort of upper cervical dysfunction
Mhm.
derangement, and you're going to have some sort of muscle tension issue that needs to be
Mhm.
addressed and released. And
Mhm.
it's a pretty good 1-2 combo for what we could do on that.
Mhm.
And I, of
For
course, yeah,
sure.
it could go down the neck, into the shoulder blades, into the
Mhm.
arm.
Yeah.
But like we said, even if it's like a cervical problem that's more lower cervical,
Mhm.
usually it's all like you said, gonna adhere and tack up and work up the chain. And
Mhm.
some of our time is gonna at least have to be spent working on the suboccipitals.
Mhm. Yeah.
So
Yeah, because you have those with the ram symbol. You have those fascial tracks that
yes.
go up all the
Hmm.
way back through there, and then insert into
100%.
the ridge there. So
Yeah,
yeah.
and then I guess going along, we'll jump
Mhm.
down to kind of anatomical chains since you mentioned the fascial tract.
Mhm.
Of course, there's the one that goes up and makes its way into like the
Mhm.
scalp and makes its
Mhm.
way up to about the eyebrow. I'm
Mhm.
gonna imagine there's a fascial tract that also
Mhm.
goes down. Is there not, Ben?
Yeah, there's the fascial tracks that go um like that go down that way and insert um kind of into the GH or in the glenohumeral
Yeah,
joint
glenohumeral joint, which
as
is your
mhm,
classic shoulder joint. When
mhm,
people say shoulder point,
mhm,
it's the GH, right?
yeah.
Glenohumeral.
But interestingly enough, if you keep following the chain of events, it's like there's two tracks that go all the way down
Hmm.
the back, and then they go all the way down to the feet, and then they wrap around
Yeah,
the bottom of the feet like stirrups,
yeah.
almost. So
Okay.
yeah.
So, you could, not saying that like, hey, plantar fasciitis, touch here and it's going to be cured entirely,
Right.
but it's recognizing
Mhm,
that, hey, part of the overall presentation, and when
mhm,
we say that everything
mhm,
does end up being connected,
mhm,
it's because it does. Like
mhm,
we function as a holistic human being, not as these
mhm,
separate regions, like
mhm,
only my
mhm,
suboccipitals and nothing else is touched, but
mhm,
it can be as involved as going all the way down to the feet.
mhm,
Now, I want to hit up a little something on anatomical connections as well too. So,
mhm,
for those that watched our second podcast on hip pain, you saw the little blurb about lower cross
mhm,
syndrome. There is an upper cross syndrome as
mhm,
well too, and the cross
mhm,
is typically going to be going through this part of your body here. And what we'll typically see is like the rhomboid muscles and like the
mhm,
middle part of the
mhm,
trap. That's going to be the weak part, and the
mhm,
pec is going to be over tight,
mhm,
and then it makes like a crisscross where like
mhm,
then the trap in the back here, like the
mhm,
trap and the levator scapula, become
mhm,
the tight and overactive part, and then the
mhm,
weak part becomes like the front of your neck, these
mhm,
muscles up here in the front that we call the suboccipitals.
mhm,
But then also lumped in kind
mhm,
of with that whole trap and levator
mhm,
is suboccipitals. So
mhm,
that's all kind of part of this upper cross where everything's tight from here to about here,
mhm,
weak from here, and then it crisscrosses and goes really tight through the chest
mhm,
and through the front of the shoulder and weak through the back of like the shoulder blades.
mhm,
And yeah, that's all going to kind of be interconnected and interplay.
mhm.
So
Yeah.
that's
So
why, again, we're going to work on the
mhm,
trap and the
mhm,
levator. We're going to work on the pec
mhm,
a little bit. I know you
mhm,
do as well too.
mhm,
Even if somebody comes in and they're like, I've got this tension headache, and they might be like, why are you working all the way down into here? Because the
mhm,
fascial train and the upper
mhm,
cross, whatever way you want to think about it, it's
mhm,
justified to work on that entire
mhm.
bundle as a group.
Mm-hmm.
right?
Yeah. So then how? Yeah. So then how can we help them with all their with somebody has what we're describing with the upper cross syndrome. You
Yeah,
know. So what are some like adjustment things that we can do to
yeah. Well,
help them out?
absolutely. I know that's kind
Mm-hmm.
of getting into
Mm-hmm.
sort of our final point, but
Mm-hmm.
we could start to give a
Mm-hmm.
small little teaser and
Mm-hmm.
everything. It all comes back to
Mm-hmm.
rehab exercises
Mm-hmm.
and some home stretches, and then the adjustments are great because we want to take that tension out of like the cervical spine and
Mm-hmm.
improve that functionality there.
Yeah.
And I know your boss mode about getting right into the muscles and actually getting that deep stretch and
Mm-hmm.
that trigger point release, all the blood flow
Mm-hmm.
back to the tissues the way that it needs to be, right?
Mm-hmm.
But we'll keep it on vague terms for right now because I want that to kind of be the
Mm-hmm.
ending note that we end on our podcast, right? So,
Okay.
um, common complaints. I'll jump off and kind of say we already sort of hit on some of them. We're going to see that tension headache is being a common complaint,
Mm-hmm.
um, and certainly like some lost, um, pain. Like we said, could go all the way down into like the arm. It can go
Mm-hmm.
down into the shoulder blade. We'll kind of see pain that can wrap up into there. Do you actually find, do people usually ever come in and sort of point right to the base of their skull as the pain, or do you think it's a little bit more like, um, the pain is kind of in other areas and then you end up unraveling it and finding the problem there,
Um.
or a little bit of both?
Yeah, it can be both. Because sometimes it depends on the person too. Because some people are really in touch with their bodies, so
True, true.
they come in and they'll like say I have a problem with this specific muscle, or the and they point right at it, and then you kind of you know then you do the analysis, and then you find like, oh, that's correct. So that's
Hmm.
do what we can to get that feeling better. But then other times it's somebody has like, I have these headaches and everything feels tight and I don't know why, and like what's so it can be like how everything initially presents can be a lot
Yeah.
different. So, but I mean, our process is going to be the same,
Hmm.
kind of no matter no
Exactly.
matter what. But
Yeah.
it's um yeah, it's we both have a very individualized approach to things. So it's not like we're going to just do the same thing for everybody.
No,
So
of course not. Of
yeah.
course not.
Mhm.
But what I like though is that
Mhm.
even though it's alluding to this, although it's like kind of a
Mhm.
different sort of assessment style, like you've
Mhm.
got the hey, let's start kind of doing some
Mhm.
movements on the table and inspecting muscles
Mhm.
and just kind of seeing how people's responses are. And ours
Mhm.
is very, dynamic movement,
Mhm.
active ranges of motion, orthopedic
Mhm.
tests. The reality is no matter how you kind of make the assessment, you come to the pretty much the same conclusion that these muscles need to be worked on.
Mhm.
So
Well, yeah,
I think
they're all
that's
gonna get worked.
yeah, of course, of course.
Either
But I
way.
think that's great that no
Yeah.
matter what our
Mhm.
assessment, we still come to the conclusion of like, hey, let's
Mhm.
work on these and
Mhm.
whatnot.
Yeah.
So staying on common complaints though,
Mhm.
lost function as well too.
Mhm.
So if these muscles are cranked up tight and we're
Mhm.
getting tension headaches, people are going to have a hard time, I find, looking down because that's going to pull
Mhm.
that whole line really tight and they'll
Mhm.
feel that it travels down the back of the
Mhm.
neck and maybe they'll even
Yeah.
say right there feels really tight. And if you do have
Mhm.
one side suboccipital a lot tighter than the other, then
Mhm.
you're going to have some movement loss on that head turn, like we said there. So
Mhm.
there's you know, maybe that's as far as I could go to the right because the left is way too tight. But then I go
Mhm.
to the left and I can move all the way over.
Mhm.
And then there's one other last orthopedic test that I think is really good for kind of unmasking upper cervical problems, tension, headache, and
Mhm.
suboccipital. And it's called a maximum cervical compression test. And what it is basically is it's a combination movement. So instead of just testing extension and testing rotation alone, you
Mhm.
do a combination of them together. And that will
Mm.
kind of really sort of, if the suboccipital muscle and the
Mm.
upper cervical is at play,
Okay.
that usually kind of jumps off at some pain or jumps off as a lot of tightness and
Mhm.
gives us a lot of clues. So
Mhm.
maybe somebody saying, I'm looking up to the top shelf to go look at something. It's like, wow, holy tight.
Mhm.
might be onto something. Might need to
Yeah.
come and see us, right?
Yeah. Yes. That again, that's not a normal thing to have all that pain when you're just kind of, just looking up that way for something, and
No,
it's
yeah.
something that we can help with. So
Yeah,
yeah.
absolutely.
Mhm.
So speaking of help, how
Mhm.
about you tell patients, and I know we were
Mhm.
kind of coming to this a little earlier in the
Mhm.
podcast, but now I think this is a nice little way to put a
Mhm.
tidy little bow on all of it.
Mhm.
What are some of your top
Mhm.
techniques to kind of get into the
Mhm.
upper cervical region, that
Mhm.
suboccipital region, and whatnot?
Yeah, so it's kind of some like it combines the techniques with the testing,
Hmm.
kind of all in one. So we can do some compression on the pectoral
Hmm.
um, muscles, which kind of maybe teasing a future
Hmm.
technique where you're kind of going like crisscrossing like that, sort of like really spreading things out and getting it ready for that. Um, get all of the work back there,
Hmm.
and then something can do to test you know the rotation side to side is kind of grabbing that lateral fascia
Hmm.
like that, and then kind
It's
of
kind of this part here,
yeah,
right? Yep.
yeah,
Hmm.
while the patient's laying face up, and then can kind of try to let the and then use that to let the neck kind of like rotate side to side, and then when or if you come across a restriction, kind of wait there a little bit for it to give it a chance to release.
Hmm.
um, so that's then you can kind of feel all of the vertebrae there as well
Yeah.
in that
Yeah.
area to see what's going on. And then something else is those kind of where you're kind of it's kind of tractiony, where you're kind of
Hmm.
like scooping underneath, and then kind of lengthening.
Yeah, kind of like a
Hmm.
lift and pull,
Hmm.
so to speak. Yeah,
Yeah,
yeah.
like a lift and pull. um I'm just um yeah, kind of like using my um so I'm not like pressing like too much up. I'm just kind of like
Yeah,
dragging,
yeah, nice.
dragging that way.
Hmm.
And then something else can also, if you really want to get like a good stretch in there, can also kind of come up behind and have my elbows on the table, and then kind of have everything like behind the head, and then you can work with your thumbs
Mm-hmm.
behind there, and also do some like pulls as as well. And then when you're doing that, like as needed to, you can have the patient, um, elevate or depress their shoulders as you're
Yeah,
doing
right.
different stuff, or resist you. So those are some of the things, and then also some more stripping, or um, some deeper work into individual muscles
Hmm.
on more specific
Yeah,
things as well. So that's a little teaser maybe
and
for some of the techniques.
that's not even touching the
Hmm.
techniques of like
Hmm.
using like the jade stone to do some
Hmm.
scraping,
Yeah.
or using like
Hmm.
like the cups to create
Hmm.
some suction release.
Yeah.
So
Hmm.
there's a lot of great stuff you've got
Hmm.
over on your side of the hallway there.
Yeah.
So yeah. Oh, and then like we like to be very rehab oriented as usual. So if
Hmm.
we think that it's a tension headache, upper cervical derangement, dysfunction,
Hmm.
suboccipital muscles being really tight, there are a couple of different renditions and ways to play with the McKenzie method exercises, but a
Hmm.
lot of times some variation or flavor of retractions, because when
Hmm.
you pull back into this retraction, it actually loads and starts to gentle stretch the suboccipitals.
Hmm.
So whether those are done as a repetitive set, whether it's
Hmm.
done as like a 30 to 60-second hold,
Hmm.
or playing with various degrees of extension with it, or various degrees of flexion with it,
Hmm.
or degrees of tilt to the side,
Hmm.
there's a lot of ways to kind of work into that. But an exercise to set patients home with to bust up that tension and
Mhm.
take down their symptoms and restore their functionality.
Mhm.
Um, of course, like if indicated, we love to manipulate.
Mhm.
Cervical adjustments do carry the highest risk of all the adjustments we do, so we always talk that through with patients and make a decision together, informed consent, if that's the right tool that we want to use.
Mhm.
But if not, then we usually find just doing a lot of good decompression with a straight pull and helping that patient clear a lot more retraction
Mhm.
makes a massive difference. And
Mhm.
much like you, I've kind of got my go to muscle techniques.
Mhm.
Those who have followed the channel long enough know that I like my pin and stretch techniques. So if I could just kind of do like a, instead of you talked about doing sort of like a tuck and pull,
Mhm.
I kind of like to do the lift and slide across the muscle bellies. And then if we
Mhm.
find that, wow, holy tight, then
Mhm.
we start to kind of work rotation and get the patient's head turning while we
Mhm.
use the fingers to kind of strip through the
Mhm.
content of the suboccipitals
Mhm.
to release the trigger points that way.
Mhm.
That is also going to be a
Mhm.
technique video that we're going to make and impost relatively soon.
Okay.
So you all are going to have to stay tuned.
Mhm.
And Ben's providing a little teaser. I'm
Mhm.
providing a little teaser as well
Yeah.
too. But the reality is, these muscles, yes, they get tight. We overload them, we over recruit them, we ask them to do too much with posture, then we don't quite move enough to really get blood flow and
Mhm.
reset to those muscle fibers. But the good thing is, it is a rather blood rich area. So
Mhm.
if we do a bit of investment for
Mhm.
patients and teach patients how to invest in themselves,
Mhm.
it does generally heal up pretty well, I find.
Mhm.
And I think you find that as well too, right?
Yeah.
Yeah.
Yeah. Yeah. Yeah. For sure.
Hmm.
It's one of those areas that on the front end, depending how severe it is, you do um for massage, might want to see you like you know at least like 2 to 4 times a month at
Hmm.
least, working like that out, and then reevaluate kind of
Of
from
course.
there. But it's yeah, it's and then once all of that is all freed up again and loose, then it's really easy to maintain.
Yeah. Yeah.
Yeah.
Yeah, and similar type of treatment plan, maybe 2 times a week starting off. If it's not as bad, we'll also start off at the weeklies and just kind of build it out
Mm-hmm.
from there according to the goals that
Mm-hmm.
are being reached. So,
Yeah.
well, I think we better wrap ourselves up here since we're getting
Mm-hmm.
close to that 30-minute mark and everything.
Mm-hmm.
So, from the B School, Be Better, Be Empowered, I'm Dr. Emery. I'm Rothrock Chiropractic and
Mm-hmm.
Rehabilitation. Our
Mm-hmm.
website is rothrockchiro.com. Follow us on Facebook at Rothrock Chiropractic and Rehabilitation. Follow us on Instagram, Rothrock Chiro. And
Yeah.
then, how about your stuff there?
Yep, I'm Ben Ciccarone, Wellness Way Massage, and wellnesswaymassage.com is where you can book your first or next session with us to, um, for a more, if you're looking for a more holistic approach to healthcare and want to skip out on those doctor bills. So,
Yeah, for sure, for sure.
yeah.
And as a final parting note, it's
Hmm.
October
Hmm.
of 24 here, and
Hmm.
I don't know about you. I still, like we said in the last episode, I'm still a fan
Hmm.
of fall. Gets a little more chillier,
Hmm.
but everybody be careful taking care of your
Hmm.
leaves out there. That's a really easy
Hmm.
way to, if you're not careful about your ergonomics, to
Hmm.
tweak up a shoulder, neck, or low back. I'm not
Hmm.
cheering for it, but if it happens, you got two pretty
Hmm.
qualified people to help you get yourself out of a
Hmm.
jam, right?
Yep, yep. As as quick as can be. So yeah,
Yes,
yeah.
yes. Well,
Mhm.
like we said, from the B
Mhm.
School, episode 3, suboccipitals,
Mhm.
thank you for tuning in. If you
Mhm.
reached the end of the video, we would deeply
Mhm.
appreciate a like, a comment, a subscription.
Mhm.
And
Yeah.
otherwise, everybody take care till next time.
Great. Bye, everybody.